This is on assessment of professionalism and ethical competencies. We will go through definitions because Nachiket hates it. Principles of assessment, criteria, what is acceptable when you're deciding what is professional and what is not professional, what is the framework for assessments, what are the instruments we have available, and a focus on workplace-based assessments, especially when it comes to ethics and professionalism, looking at the setting of the assessment. So when I ask you what is an assessment, according to me it is simply a judgment of someone's ability to perform a certain job. And we all agree that assessment, which is a session which I love to take, is king. And you can have all the fancy methods you want in presenting how you're going to teach, what you're going to teach, etc. But as long as the examiner, the external examiner, decides the question, the student will learn what I ask. So assessment is king. If you really want them to learn professionalism, communication, and for that matter ethics, you have to be the assessor who asks that question. What is professionalism? I remember clearly from this diagram that professionalism is all about three foundations. The person who has an ethical and integrity-based education, who is able to communicate and is competent in his or her field of medicine, and with four pillars which hold professionalism up, one being the search for quality and excellence, humanism, accountability, that is social accountability, and of course an altruistic feeling makes a person truly a professional, and therefore that defines professionalism. The principles of ethics we heard already. We know that it includes beneficence, do good. We know it means non-maleficence, do no harm. We know it means justice, being fair to all concerned, and finally autonomy, respecting the patient, respecting the team, and therefore respectful communication. What are competencies? I won't go into competency versus competencies and all that definitions, but in my book, competencies basically are required to fulfill a professional role. We have MBBS graduates who come to medical school to become clinical doctors initially, with all due respect to the biochemistry friend I made little earlier. The professional role, one of the professional roles of an MBBS doctor is to be a clinician. To achieve this clinical role, one needs to have competencies. And to achieve those competencies, there is a degree of cognitive domain, skills, and attitudes required to become competent, and all these competencies leading up to the ability to perform the role. And it's important to remember that assessment of cognitive domain of the heart, that is attitudes, and of the skill, which is psychomotor, does not necessarily equal an assessment of competencies. The principles in assessing professionalism therefore are very clear. Assess early in MBBS, frequently and continuous. Look at various perspectives. Take multiple sampling of cognitive, psychomotor, and attitudes. Assess using multiple methods, quantitative and qualitative, written and clinical. And most importantly, go to the workplace and observe behavior of students and graduates to decide assessment. Not forgetting that formative assessment is vital in professionalism and ethics, because you don't become ethical like me on the day you were born, unlike y'all. What criteria makes an assessment good? I like this little equation because it's got maths, and I hated maths, but it's all about reliability adding on to validity with an educational impact, a feasibility and acceptability, which finally decides an assessment's utility going forward. Reliability, we all know, is do we hit the target at the right place constantly? consistently at a particular place. But we need to remember there is validity. Do we hit the target consistently, but on target, right in the center and the bullseye, truly measures what it meant to measure? Or do we review the process of improving that? The education impact is impact of assessment on the learner, because it is the heart of the hidden curriculum, irrespective of the objectives written down in the curriculum. One must remember that there are issues of feasibility when it comes to cost, and doctor-student ratios become very important when you look at formative assessment of feasibility and acceptability. The ease of implementation and the acceptability by faculty. If the faculty are not involved, and for that matter, if the student is not involved and doesn't accept it, you're going to be finding it very difficult to teach and assess professionalism and ethics. And it's all about that going forward. So how do I decide whether I am professional or not professional? Is it based on a normative assessment where I compare myself to an individual's performance and it's relative to my peers? Fortunately, my class of 1981 was a terrible batch, and we all therefore are highly professional according to us, because we were compared to our peers, that our own classmates. However, if it was a criterion batch, reference assessment based on people in this audience who are highly ethical and professional, I would find myself below the standard which was predetermined and set. And therefore, I did not achieve the essential professional skills or ethical skills to pass that particular exam. And therefore, it becomes important, because this is the predetermined standard. Miller's pyramid will keep coming up. Knows how, shows how, does. And when you look at professionalism and ethics, it is obvious that the novice probably becomes more professional, more ethical, hopefully, as he goes up the ladder and becomes an expert. It could be that I know the facts, I recognize the potential unprofessional or unethical behavior. I may be able to demonstrate it in an OSCE where I'm very polite and very observed in an artificial situation, or I may be totally different Sanjiv when I am beside my patient, taking money, getting cut practices, and even staying in resorts. When you look at the authenticity of this entire system, you see very clearly that you can check the basic knowledge by using written MCQs. You can look at case vignettes to discuss whether the student understands or knows how to recognize and deal with situations which are unprofessional, unethical. But to show how, we need to give scenarios in OSCEs, preferably, usually simulated. And finally, the best advantage of a workplace-based assessment is you're going to watch this doctor behave in the ward, behave in the outpatient with patients. And that ultimately decides, is Sanjiv professional, ethical, or like Nachiket, unprofessional, unethical. We'll talk about that later. Instruments, therefore, we have are written, and we also have workplace-based assessments and portfolios. And I will focus on workplace-based assessment. And when you look at it, it's all about direct observation in a realistic setting. Fragmented views taking place, context differs. It could be different contexts under different stresses where a person behaves unprofessionally or professionally, and it's mainly a lot of formative assessment and feedback. Similar to the mini CEX, which we all know about, there is also a PMEX. And in this PMEX, it focuses on professionalism, where it assesses attributes of reflection of doctor-patient relationship, time management, interprofessional relationships can be assessed, and it's all formative, because professionalism and ethics is all about role models, role modeling, and formative feedback. Of course, one may look at the mini CEX, and there are mini CEXs which already have elements of professionalism, or you can look at the PCEX, which I've already distributed, where you look at professionalism per se. Of course, it is well known that the peer rating or the patient rating a doctor or a nurse or a student behavior with or without him in training assessments, a minimum of 12 ratings taking place is very authentic, especially if it doesn't matter if the peer is chosen or allocated. Of course, there are issues about whistleblowing, and it's best to collect this data anonymously. Multi-source feedback, 360 degrees, taking feedback from different type of people that the doctor or the graduate or the student deals with. And it's useful for reflection. Again, strong tool for formative assessment. Finally, self-assessment, where one assesses one's own performance and facilitates self-awareness. Reliability is questionable, but again, a great tool for self-reflection and formative improvement. Because reflection is most important, and it's very difficult for us to assess reflections, but the focus of reflections is self-directed to improve one's ability to see where we are, where we are going, and how we can change our course as professionals and ethical human beings. Another tool with NABH, I noticed that this hospital has NABH, is I hate NABH simply because it's all about paperwork, and my nurses are only doing paperwork, leaving my poor patients alone. However, there is one element in NABH which is an excellent teaching tool as well as a formative tool, and it is the critical or sentinel incident reports, where one can get short narratives, discuss it, and even pinpoint areas of improvement. And please have a look at the incident reports in the NABH system. Portfolio goes beyond the logbook. The logbook is, I got up in the morning at 8 o'clock, I had breakfast at 8:30, I'm not sure whether I had a bath, but okay, we'll go on to that. I reached here at 9 o'clock, I started my session, I had lunch, that is logbook. But portfolios has narratives, it has reflections, it allows me to show whether I have grown through my first year, second year, third year and beyond. And therefore it's a great formative as well as a potential summative tool to take this forward, especially when you look at professionalism and ethics. The setting therefore for professionalism and ethics is not in the classroom, but is beside the patient, because we know the more authentic the setting is, we're more likely to assess professionalism and ethical behavior outside the classroom, but actually in the place of work. And therefore, it is the workplace where you set and you teach and you even formatively assess professionalism and ethics. In summary, assessment is king. It is not mathematical that A, B, and C equals competence. Remember, should be reliable, valid, educational impact, feasible and accessible. And remember, it is authenticity which matters. Assess them using workplace-based assessments at the place of work when it comes to professionalism. With that, I'd like to thank you for this opportunity.